Hello everyone, I am myself Dr. Rajesh Gubba. I am the General Medicine Educator. So in this session I will be discussing a very important topic in the neurology, that is prions and the prion diseases. So if you see the first question, which of the following statements about the prions is true? They are the infectious proteins, they are made up of bacteria and virus, they have rich nuclear material, they can be cultured in cell-free media. So the exact meaning of this word prion is that these prions, they are the infectious proteins. Right, these prions, they are called as the infectious proteins. Now, what is the nuclear material in the prions? Prions are infectious proteins with only DNA, DNA and RNA, only RNA, none of the above. Let me tell you, prions are the infectious proteins with no nuclear material, right? There is no DNA, there is no RNA, there is no DNA and RNA as well. So they don't have any nuclear material and they are the infectious proteins, right? So they are the infectious proteins devoid of any nucleic acid. Right, devoid of any nucleic acid. And these prion diseases, it results from accumulation of abnormal protein, right, due to accumulation of abnormal prion protein, right, and that will be PrP Sc. And these prions, let me tell you, they are most resistant to the physical and as well as the chemical agents. Right, they are most resistant to the physical and as well as the chemical agents. Now you need to know what are those chemical agents. Right, they are resistant to substances like the formalin, right, and they are also resistant to heat, right, and they are also resistant to irradiation. Right, so that is about the prions. Right, they are most resistant to the physical and as well as chemical agents such as the heat, irradiation and as well as the formalin. And they are sensitive to what then? Because they are proteins, you know, they are sensitive to proteases. Right, they are sensitive to proteases but resistant to nucleases. Right, but resistant to nucleases. Right, why? Because they do not contain the nucleic acids, that is why they are resistant to the nucleases. And the diseases caused by prions include the diseases in humans. The prions will cause the diseases in humans and as well as in the animals. Right, as well as in the animals. That is what is the disease caused by the prions. Now you see this question. Which of the following is not a human prion associated disease? Scrapie, Kuru, Creutzfeldt-Jakob disease, Gerdsmann-Straussier-Schinker disease. So out of which the one which is not a human prion disease is the scrapie, right? Scrapie, it is not a human prion associated disease. Now let me tell you the examples of the human prion diseases and as well as the animal prion diseases. So let me just give you a mnemonic. The mnemonic is KFCG. K stands for Kuru. Right? K stands for Kuru. And the word F is your fatal familial insomnia. Right? Fatal familial insomnia. And what does this C stands for? C stands for Creutzfeldt Creutzfeldt-Jakob disease. Right, the Creutzfeldt-Jakob disease, and the word G will be Gertzmann-Straussier-Schinker disease. Right, so these will be the examples of the human prion diseases. Now you need to know what are the animal prion diseases. So you have gone to KFC, and what is that you have ordered? You have ordered a beef bucket, which is an animal, and then the Cheetos sandwich. So BEEFCS. Okay, this will be the mnemonic for the animal prion diseases. So you take the word B. B stands for bovine spongiform encephalopathy. Right, bovine spongiform encephalopathy. Right, so that will be the word B. And you take the word E. E stands for exotic lingulate encephalopathy. Right, exotic lingulate encephalopathy. That will be the word E. So if you take this word E, the word E stands for encephalopathy. Right, and what encephalopathy? It is the encephalopathy in the mink. So that is nothing but your mink encephalopathy. And you take the word F. F stands for feline spongiform encephalopathy. Right, feline spongiform encephalopathy. And you take the word C. C stands for chronic wasting disease. Right, chronic wasting disease. Okay, so if you take this chronic wasting disease, it is the one which occurs in deer and as well as elk. And you take the word S. The word S stands for scrapie. Right, so the scrapie is the animal prion disease which occurs in sheep. So these are the animal prion diseases. Right, now after having discussed about the animal and as well as the human prion diseases, now let me discuss one important question. Which of the following is not a feature of the fatal familial insomnia? Right, fatal familial insomnia is what? It is a human prion disease. Let me discuss few points on this fatal familial insomnia. The options are prion disease, decreased sleep, mental retardation, vascular disease. Let me tell you, this fatal familial insomnia is a prion disease, and that too a human prion disease. And insomnia, that itself tells you that the individual has a decreased sleep. So two options we are able to rule out the two options easily. But the third and fourth option, if you see, mental retardation and as well as vascular disease. Let me tell you, it is not a vascular disease, it is a prion disease, and these individuals, they have the mental retardation. So if you take this fatal familial insomnia, it is a rare genetic degenerative brain disorder. Right, it is a rare genetic degenerative brain disorder. That is what is your fatal familial insomnia. And what is the characteristic feature in this fatal familial insomnia? These individuals, they have the inability to sleep. That means they have insomnia. Right, they have insomnia, that is inability to sleep. And this insomnia, it is initially mild. right? Insomnia, it is initially mild, but progressively it worsens. Right? Progressively it worsens, leading to significant physical and mental deterioration. Right? So they have significant physical and mental deterioration. Right? So these are the characteristic features of this fatal familial insomnia. Now, particularly if you take the features of the prion disease, they share several distinguishing hallmarks. And in these individuals, the disease is confined to the nervous system. Right? It is confined only to the nervous system. Right? Although agent may be recoverable from the other organs also, majority of it is confined to the nervous system. And what will be the basic feature of this particular prion disease? It is neurodegeneration and spongiform changes. Right? Neurodegeneration and spongiform changes. That will be the basic feature. And in these individuals, the amyloid plaques may be present. Right? What are these amyloid? Amyloid is nothing but the abnormal protein which gets accumulated. So the amyloid plaques may be present, and these prions are also nothing but your abnormal proteins. And if you take the incubation period in these patients with the prions, they have a very long incubation period. Right? They have a very long incubation period. So the incubation period will be there for nearly around months to decades. Right? Incubation period will be there for months to decades. And if you take the onset of the clinical illness, the onset of the clinical illness is followed by, right? The onset of the clinical illness is followed by chronic progressive disease. Right? It is followed by a chronic progressive disease. And this chronic progressive disease will be there for weeks to years. So that is about the distinguishing hallmark features of the prion disease. Right? The disease is confined to the nervous system. The basic features are the neurodegeneration and spongiform changes. Amyloid plaques may be present and they have a long incubation period, and onset of clinical illness is followed by the chronic progressive disease. Now, let me just tell you all these features in the form of a mnemonic. Right? The word P stands for the plaques. Okay, the mnemonic itself is the prion. Okay, so the word P stands for the plaques. Okay, and what plaques are those? They are the amyloid plaques. Right? They have amyloid plaques. And if you take the word R, see what are the basic features I have said you? That is neurodegeneration. Right? Neurodegeneration and as well as the spongiform changes. Right? And see, what are these spongiform changes? Right? Spongiform changes. Now, what do you understand by this word, the spongiform changes? Spongiform changes means they are defined as small, round or oval empty spaces in the brain. Okay? Small, round or oval empty spaces, right? So that is what you mean by the word neurodegeneration. And if you take the incubation period, I stands for incubation period. So how will be the incubation period? They have a long incubation period. And if you take the word O, the onset of, right, the onset of the clinical illness, right, the onset of the clinical illness, it is followed by a chronic progressive disease. Right, it is followed by a chronic progressive disease. And the word N stands for the nervous system. So the disease is mostly confined to the nervous system. So that is about your prions or the prion associated diseases. And these are the spongiform changes, right? So what is that spongiform changes? I said you, small, round or oval, empty spaces within the brain, that is what is your spongiform changes. Okay, so they have neurodegeneration and spongiform changes, right? And these spongiform changes, they are defined as small, round or oval empty spaces. Now after having discussed about that, you need to know what is the prognosis in these patients with the prion diseases. The disease is always fatal, right? The disease is always fatal with no known cases of remission or recovery, right? There is no known cases of remission and recovery. Okay, and in these patients with the prion disease, the host shows no inflammatory response and no immune response, right? So okay, so this is what is the prognosis in these patients. And I said you, there is no immune response also. Why? Because the agents do not appear to be antigenic, right? So there is no immune response. So why is that there is no immune response? Because the agents they are not antigenic, right? And there is no production of there is no production of the interferon, right? No production of interferon is elicited, and there is no effect on host B or T cell function, right? There is no effect on host B and T cell function, right? There is no effect on host B or T cell function. Okay, and this is about the prognosis in these patients with the prion and as well as the prion related diseases, right? I'll just discuss one more clinical scenario. A 60-year-old man with progressive dementia of recent onset presents with intermittent irregular jerky movements, right? Intermittent irregular jerky movements. The EEG shows periodic sharp biphasic waves. The most likely diagnosis is, the options are the Alzheimer's, Creutzfeldt-Jakob disease, Lewy body dementia, herpes simplex, encephalitis. So here the individual is having periodic sharp biphasic waves. The EEG showing periodic sharp biphasic waves, right? And the individual is also having the involuntary movements, that is intermittent irregular jerky movements. So what is the most likely diagnosis suggestive of? The most likely diagnosis, it is suggestive of the Creutzfeldt-Jakob disease. Now, if you take this Creutzfeldt-Jakob disease, we have the various forms of the Creutzfeldt-Jakob disease. Now, you need to know what is the most common form of the Creutzfeldt-Jakob disease. The options are sporadic Creutzfeldt-Jakob disease, the iatrogenic Creutzfeldt-Jakob disease, acquired variant. Let me tell you, the most common form of Creutzfeldt-Jakob disease is the sporadic Creutzfeldt-Jakob disease. Now, what do you understand by this word, the sporadic Creutzfeldt-Jakob disease? So, I said you, this is the most common form of Creutzfeldt-Jakob disease, right? And it accounts for 85% cases of the Creutzfeldt-Jakob disease, okay? And it has no known cause, right? What exactly is the cause is not known. It is idiopathic, and it is the most common form of the Creutzfeldt-Jakob disease, and it is also the most common form of the human prion diseases as well. And we have another form of the prion disease, that is the variant Creutzfeldt-Jakob disease, right? That is variant Creutzfeldt-Jakob disease. So the transmissible prion disease is described only for Kuru and Creutzfeldt-Jakob disease, right? What is this variant form? The variant form is a transmissible prion disease. Whereas, if you take this iatrogenic transmission of Creutzfeldt-Jakob disease, this iatrogenic transmission of Creutzfeldt-Jakob disease is associated with prion contaminated human corneas, right? It is associated with prion contaminated prion contaminated human corneas and prion contaminated dura mater grafts, right? And prion contaminated growth hormone and prion contaminated gonadotrophins, right? And prion contaminated electrodes, right? And prion contaminated neurosurgical instruments. Right, so that is about the iatrogenic transmission of the Creutzfeldt-Jakob disease. Now, if you take a short review of this Creutzfeldt-Jakob disease, the nature of illness of the Creutzfeldt-Jakob disease is, it is heritable, right? It is a heritable form, and it is a degenerative disorder, and it is an infectious disease. That is the nature of illness of the Creutzfeldt-Jakob disease. It is heritable, degenerative and infectious disease. And this Creutzfeldt-Jakob disease, it is the most common prion disease in humans. That's a very important multiple choice question. See, what are all various human prion diseases? The various human prion diseases that we have is the fatal familial insomnia, right? Just now we have discussed the individual will have decreased sleep, right? And another important form of the Creutzfeldt-Jakob disease is another important form of human prion disease is the Creutzfeldt-Jakob disease. The other examples like what we have is Kuru and as well as Gertzmann-Strontier-Schinker syndrome. These are all the human prion diseases, and out of all these human prion diseases, the most common will be the Creutzfeldt-Jakob disease. And I have said you, like, we have the various forms again, out of which the sporadic Creutzfeldt-Jakob disease, that is the most common form, right? Next. And if you take the major pathological change, the major pathological change in case of Creutzfeldt-Jakob disease, it is confined to central nervous system, right? It is confined to central nervous system. And this Creutzfeldt-Jakob disease, it can manifest both a heritable and as well as the infectious illness, right? So that is about a short review of the Creutzfeldt-Jakob disease. And you need to know what will be that CNS manifestations. That CNS manifestation, please remember this mnemonic of Creutzfeldt-Jakob disease, that is CJD. C stands for the clonus, okay? Most patients, they exhibit myoclonus. right? Most patients, 90% of them, they exhibit, right, they exhibit myoclonus at some time throughout the illness. And you take the word J, that is just like that, that is non-specific prodrome symptoms. Right, non-specific features. And what will be that non-specific features? That includes fatigue, sleep disturbance, weight loss, then headache, and malaise. So these are just like that, that is non-specific prodromal symptoms that you will have in patients with the Creutzfeldt-Jakob disease. And the word D stands for dementia, right? And the dementia, it is due to deficit in the higher cortical function. So dementia is nothing but your memory loss. Right, that is your memory loss. And there will be impaired judgment, then there is a decline in intellectual function of the individual. Right, decline in the intellectual function of the individual. So that will be the dementia. So CJD, C stands for the clonus, that is myoclonus. J is your just like that, that is non-specific features or non-specific prodromal symptoms. And D is your dementia, right? So these are the clinical manifestations that you will have in patients with the Creutzfeldt-Jakob disease. And now, apart from the clonus and as well as dementia, cerebellar signs, visual impairment may also occur in these individuals. Right, cerebellar signs and as well as the visual impairment may also occur in these individuals. Now, having said this, let me tell you, the probable diagnosis requires the presence of rapidly progressive dementia plus 2 of the 4 clinical manifestations. So, there should be dementia. Along with that, there should be either myoclonus or there will be visual impairment or there is development of cerebellar signs or there can be pyramidal or extrapyramidal signs. Right, pyramidal or the extrapyramidal signs. Okay, so these are the 2 of 4 clinical features that you will have to diagnose the Creutzfeldt-Jakob disease. But definitely there should be presence of rapidly progressive dementia plus 2 of the 4 clinical features, that is either myoclonus or visual impairment or cerebellar signs or pyramidal or extrapyramidal signs. Now, you need to know what will be the CSF findings in patients with the Creutzfeldt-Jakob disease. 14-3-3 protein, 15-3-3 protein, 16-3-3 protein, 17-3-3 protein. Now, what is that CSF finding you will have in Creutzfeldt-Jakob disease is, it is 14-3-3 protein. What does that mean? See, 14-3-3 protein are a family of conserved regulatory molecules that are expressed in all eukaryotic cells, right? They are expressed in all eukaryotic cells. And this 14-3-3 protein, it has the ability to bind a multitude of functionally diverse signaling proteins, right? It has an ability to bind multitude of functionally diverse signaling proteins. Right, functionally diverse signaling proteins, right? So what are those functionally diverse signaling proteins? That includes kinases, right? Then phosphatases, right? And transmembrane receptors. Right, transmembrane receptors. So these are your 14-3-3 proteins. So they have the ability to bind a multitude of functionally diverse signaling proteins, including kinases, phosphatases, and transmembrane receptors. Right, and these are the family of conserved regulatory molecules that are expressed in all the eukaryotic cells. Right, as well as a positive laboratory assay of this 14-3-3 in the CSF is very much suggestive of the Creutzfeldt-Jakob disease. And in these patients, whenever you do an MRI, right, MRI, there is high signal in the caudate and as well as putamen on diffuse weighted or fluid attenuated inversion recovery imaging. So in case of the flare imaging, there will be, that is MRI flare, there will be high signal in the caudate nucleus and as well as in the putamen, right? High signal in the caudate nucleus and as well as the putamen. And if you take the characteristic EEG, characteristic EEG shows paroxysms of high voltage and slow waves, right? In Creutzfeldt-Jakob disease, there will be paroxysms of high voltage right, paroxysms of high voltage and slow waves. And what will be the treatment? There is no specific treatment in patients with the prion and as well as the prion disease. So let me just summarize the entire Creutzfeldt-Jakob disease. So the diagnosis of the Creutzfeldt-Jakob disease is based on combination of the progressive dementia, then the myoclonus, right, then myoclonus, and you also have multifunctional neurological dysfunction, that will be pyramidal and as well as extrapyramidal dysfunction, visual or cerebellar disturbance, and there will be also akinetic mutism. And typical EEG findings, it shows the periodic synchronous biphasic or triphasic sharp wave complexes which are typical of the Creutzfeldt-Jakob disease, right? So this is about a short summary on the Creutzfeldt, this table is a short summary of the Creutzfeldt-Jakob disease. Now you see another question. All of the following statements about Creutzfeldt-Jakob disease are true except it is a neurodegenerative disease caused by infectious proteins. Myoclonus is rarely seen. Brain biopsy is specific for diagnosis. Let me tell you, in almost 85 to 90% of individuals, myoclonus is seen. Rarely seen is an incorrect statement. The question asked is except. And definitely it's a neurodegenerative disease which is caused by the infectious proteins, and the brain biopsy is the one which will help you in the diagnosis of this Creutzfeldt-Jakob disease, right? So human prion diseases, one is your scrapie, Kuru, then Creutzfeldt-Jakob disease, and then the fatal familial insomnia. These four are your human prion diseases, out of which you need to be very much aware of the Creutzfeldt-Jakob disease, right? So this finishes the topic of the prion or the prion related diseases. Thank you very much.